Good day everyone, Hermal lecture by Marifel B. Salves Edu English Major Batch 4. High blood pressure or hypertension, symptoms, causes, and treatment. The overview. High blood pressure hypertension is a common condition in which the long-term force of the blood against your artery wall is high enough that it may eventually cause high problems such as heart disease. Blood pressure is determined both by the amount of blood your heart pumps, the amount of the resistance to flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher blood pressure. A blood pressure reading is given a millimeter of mercury. It has two numbers. The top numbers is the systolic blood pressure. The first or upper number measures the pressure in the arteries when your heart beats. The second is the bottom number, the diastolic pressure. The second or lower number measures the pressure in your arteries between beats. You can have high blood pressure for years without any symptoms, and contrarily, high blood pressure increases your risk of serious health problems. Here are symptoms. Most people with high blood pressure have no signs of scientific. Here are headache, shortness of breath, or nose bleeds. But their signs and symptoms are specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. There are two types of high blood pressure, the primary essential hypertension. Here are some risk factors: age, diet, physical activity, alcohol, obesity, drugs, stress, family, and here are second, hypertension. Some people have high blood pressure causes of the underlying condition. This type of high blood pressure, called secondary hypertension, tends to occur suddenly and cause higher blood pressure that doesn't primary hypertension virus condition. Here are medication of the lead of the secondary hypertension, including obstructive sleep apnea, kidney disease, adrenal gland tumor. Here are kidney section and kidney. Adrenal tumor presented, and thyroid gland. Anatomy of the thyroid and parathyroid gland. And here are the certain defect you're born with, congenital and the blood vessel. With the congenital hyper, certain medications such as birth control pills and a cold remedies. Here are vitamin C, as infinoi we called as tuob. We are drinking water, decongestant, or we drink it, a pain reliever in order to and a tablet for pain reliever, and some prescription drugs. Here are some prescription drugs that we see. Illegal drugs such as cocaine. Here are cocaine that is illegal, and amphetamines. Here are some questions. What food causes hypertension? So, there are foods that high in sodium, produced foods such as lunch meat, sausage, bacon, and ham. Cocaine, soap, bolide, dried deli meat, consement. And what is the main causes of hypertension? The most common causes of hypertension include smoking, obesity, or being overweight, diabetes, having a sedentary lifestyle, lack of physical activities, high salt of alcohol intake level. What are the four stages of hypertension? Hypertension state normal, systolic less than 120 mm of mercury and diastolic less than 80 mm of mercury. Elevated systolic between 120 to 129 mm of mercury and diastolic less than 80 mm of mercury. 3. Stage 1 systolic between 30 to 139 mm of mercury or diastolic between 80 to 89 mm of mercury. If your blood pressure is extremely high, there are certain symptoms to look out for, including, here are some symptoms, including several headache, nosebleed, fatigue or confusion, vision problem, chest pain, difficulty breathing, irregular heartbeat, and blood in the urine. Preferred by Marifel B. Salazar, to English Major Batch 4, preferred to Mrs. Arlene B. Birago. And thank you for listening my lecture about hypertension, and I hope you have learned it.